different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hairloss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
So I just tell Dr. Anderson to make sure that his laptop volume is down. And mine was way up. How's everybody? What's going on, guys? Joe, good to see you.
Doing great. Thank you. Good to be here. Good to see you guys.
What's
Doc,
up,
welcome.
Joe? How you been, man?
Fantastic, my friend. Good to see you in studio.
Thanks. It's great to be here.
Right guys, guys who are just tuning in, let me give out the phone number. It's 888-659-3727. As you may or may not know, this is the Hair Loss Show, The Bald Truth. Been doing the show for going on 26 years in some iteration or another. Started back on WABC Radio back in 1998. And all we do is essentially provide you guys with anything and everything as far as the truth when it comes to hair loss and this insane hair loss industry. As you can see, we have a guest this week, Dr. Ken Anderson, IAHRS accepted member, been with us for forever, it seems. But you don't age, man. Good to see you.
Oh, it's just it's good, clean living.
That's what it takes, man.
That's what it takes.
That's what it takes.
Got to work at it.
It takes a lot of work. As you can see, I rearranged the studio, and I have like a little home gym in my studio.
Well, yeah, you know what? That's actually I have a gym at home myself, and I'm proud of you, bud.
Thank you.
It's not easy, We all should be working out, but getting that motivation up. I don't know about you guys, but I find that there's this weird sort of reluctance to go to my home gym. But 3 minutes into the workout, I'm really glad I'm there, and it's a lot of fun. And it's just kind of a weird.
You cannot negotiate, man.
A little barrier.
You can't negotiate with yourself.
I sold my COVID gym once things opened up, and I make the walk down the hallway to my building gym and pool, and I use that. That's more motivation for me to get out of the house.
We have an incredible gym here, an incredible indoor pool, and all that stuff. And I have to say that I like having access to equipment in my home because I was so used to it when I was in Calabasas for so long. And just, sometimes I just like I'll watch Rogan or something and just train. And I'll go to the gym as well. But Doc, yeah, you can't, I know exactly what you're saying. You can't negotiate with yourself. Like I get up in the morning, I take a cold shower.
Really?
I go in a freezing cold shower for 10 minutes. And it's insane. And once I get that done, I could do anything, man.
It's, my employees are telling me about, some of them are telling me about the benefits of a cold shower, and I don't have the guts. It's just after my workout in the morning, I get up. I've been doing this thing for about almost a year now. I get up at 5 in the morning, or 5:15 sometimes before surgery, and hit the home gym for about 45 minutes or so. But I always enjoy the warm shower after the workout. I don't know if I can. Do you guys know about the health benefits? Or is there anything specific?
Well, I've heard about them, and my wife has been telling me to take a cold shower like all the time for the past several years, but that's usually not in the morning. It's, so I'm like, there's got to be something to it. She's been telling me. But no, it's supposedly...
That was the funniest thing you've said in a fucking year. So I just cursed already. You see? It already started.
Already. See? All right, fine.
First one.
New show starting in half an hour so we can avoid the algorithm. Thank you so much. No, it's the health benefits of that are supposed to be mainly, there's some supposed muscular benefits to it, but it's just to shock the brain into activity.
Look at me, man. Come on. Can't you see them? I'm just kidding. Guys, the phone number is 888-659-3727. In my view, I could say that it definitely helps with everything. Hair, skin, just mindset. It increases your dopamine for hours. And
yes.
I kind of feel like I can conquer the world once I do that. And it is torture, man. Absolute torture. And we have a cold plunge downstairs as well. But, I don't like the shared cold plunge situation.
Are you guys talking cold shower, like just the cold water, or no? It's not even lukewarm.
Cold water. So my shower, I tested it. It's like it's not even that cold. It's like 60 degrees. But that's cold when you're almost 100 degrees. And you go into that shower. Anyway, guys, this is the hair loss show. By the way, we're just kind of BSing a little bit at the top of the hour.
Yeah, by the way, we're here about hair.
Yeah, 888-659-3727. It's a unique opportunity to speak to a hair transplant surgeon and get some insight while, look, we've been doing this for a long time, Joe and I. Joe's been in the industry himself for almost 2 decades. He's had like 30 hair transplants. I've been doing this since 1998. And while I've avoided having a hair transplant, it's like a total, like Trump the early years situation. I basically, it's like a can of hairspray and paint. But I have to say that, in my particular situation, it was early intervention with medical therapy that really helped me. And while everyone was telling me to avoid this, I decided, you know what, I'm going to give it a shot. And I think, in today's world, a lot of young guys who are contacting me through Instagram, they're hyper concerned about getting on medication, Doc. Hyper concerned. I understand when you read about what's going on with Finasteride, for instance, online, the adverse side effects are, they're magnified because these are the people that are talking about it.
Yeah.
The guys with the success stories are moving on with their lives.
Well, with Finasteride, it was a bit sus, as the kids say these days. The drug came out, Finasteride, marketed as Propecia. It was released in 1998, and the FDA paper, when you get your prescription, has all that paperwork in there, and what they told the world, including doctors, was that the side effects are rare, and if you get like the most common is the decrease in libido. If you suffer that side effect, that it's reversible. But then in 2014, the FDA came out again and said, "Oh well, geez, we were wrong," and a certain percentage of people will have post-finasteride syndrome, which is a decreased libido and other issues that into perpetuity. It never goes away, and so I'm a much bigger fan of prescribing topical finasteride as opposed to the oral finasteride, especially in younger guys.
Now, I have a question about that.
Yep.
And correct me if I'm wrong, but from my understanding, the FDA came out and they had to incorporate this stuff, these potential adverse side effects into their literature and into their warnings because people are reporting it. But from what I understand, there was a study in their initial study where there were a handful of guys who seemed to have longer lasting side effects, but then they never came back to complete the study. So they didn't really, to my knowledge, there's no, and again, Joe, maybe you could help me out with this. There's no clear data showing that there's any permanent adverse side effects. However, there's a lot of anecdotal data. And so Merck put it into their information.
I'm reminded of the Washington University study, which up to one point was the definitive reference when people were talking about PFS, and when I looked at it, I was shocked that it wasn't a study; it was simply an examination of information that was already out there. Nothing published per se. As a scientific journal, but it wound up being a survey of people that had already complained of having PFS or side effects.
That's true,
or what have you.
But Merck did come out and say, you know what? Yeah, there were some findings that we kind of, from what I understand, that we kind of kept from the public. But as far as like the number of guys with long-term adverse permanent side effects, to my knowledge, Dr. Anderson, they never really found those guys from the study. However, there were so many people complaining online that they decided that they had to. I guess once the drug is on the market and you have all these, these adverse side effects in practice, these pharmaceutical companies will then include it in the literature. Mm-hmm. Is that right?
You know, I'm not really up on exactly how the FDA works.
Okay.
I'd be guessing.
Well, you know what? I admire your honesty, man. Because a lot of guys would sit here and guess.
No.
You know?
They try to push through. We're trying to make it sound like they know what they're talking about. So kudos on that. It's like I just don't know. Yeah.
Nah, you gotta.
I like that. I like that.
But there are guys out there for sure. So when people contact me that are complaining about long-term adverse side effects from finasteride, I think the thing that kind of bugs me about, I guess, the FDA and about what, and also how things are kind of the narrative is created online is, women are given these, I guess, they're exogenous hormones, birth control pills from a very young age. And there is causal, like right now, a lot of birth control pills, at least one that I know of, has a black box warning. But the adverse side effects from hormonal birth control, I can't even say that, Joe, is staggering. And that includes permanent sexual adverse side effects in women.
Mm-hmm.
And no one talks about that because I guess it's kind of like, there's maybe a little politics wrapped around birth control. But I do think that women should have full disclosure before, taking this medication, or parents allowing their children to take this medication.
And forget about the side effects of hair loss. Like it's everything else.
It's huge.
It should be talked about. But hair loss is also a big one that no one talks about.
I gotta say,
don't talk about it.
I gotta say, I will. Interestingly, when I was in medical school, my very first hair loss patient was a girlfriend of mine, and she was, I was in the middle. I was 23 years old, and as was she, and she started having hair loss right at the midpoint of her frontal hairline, and it was really odd, and it was devastating to her, so much so that she went out and got like a little clip-in hairpiece, and so I said, what? And I just kind of I asked her. I didn't know. I didn't even know I'd be getting into hair later, but I asked her, what are you taking any medications? And she was taking a birth control pill. And I looked up in the reference to the PDR, it's called, and they had a chart there of the androgenizing effects of various birth control pills. And her birth control pill was at the very top of the list.
Low estrogen, probably.
Yeah. And so I wasn't even a doctor. I was just Ken. And I said, you should ask your doctor to go ahead and switch you. And so she got switched to a one that was not or much lower on the list, and took a few months, but all her hair came back. And I occasionally see patients like that today. I saw one about a month ago, female patient came in, and sometimes when they see the hair restoration surgeon, it's the last stop. They've seen the dermatologist, the family practice. So she'd already had SMP into the area. And her only medication was an oral birth control pill. And I recommended she, see her OB-GYN physician and switch to one with lower androgenizing effects. And that was just recently. I'm looking forward to following up with her to see if all the hair grew back. But it's just as we all know, hair loss for women is absolutely, it can be just devastating. And these patients sometimes don't go outside, and depression is a common comorbidity with that. But the birth control pill definitely associated with hair loss.
Well, I can tell you that, at least in my experience and just seeing how things have evolved over the last, 2 decades, there's no doubt in my mind that the use of hormonal birth control is probably the number one trigger for early onset female androgenetic alopecia. There's no doubt in my mind. Women are taking it at younger ages now. They're not just taking it as birth control. It's being prescribed for people with, different hormonal issues, young girls who have, issues with their menstrual cycles and acne and stuff like that. And these doctors prescribe it like it's candy, and they don't realize this. It's like giving someone steroids.
Yep.
That's exactly what, and you're giving it to children. Or as soon as somebody turns 16, the mom's like, yeah, you know what? Let me get you on birth control. It's a responsible thing to do. They have no idea what they're doing to their body. And these women aren't producing their own hormones anymore. So I'm not a fan, and I got to tell all of you guys. And listen, I certainly benefited from the use of birth control pills throughout my life. But I can tell you this: that if I had a daughter Or if I had, if I could do it all over again, I would tell any woman I was with not to get on that stuff.
But you would be glowing if you had a baby bump. I'm telling you.
Me?
You would just glow. Yeah.
I might. You never know. Guys, listen, this is a call-in show.
Sorry.
This is a call-in show. I turned the phones on for you guys to call in. We had a couple of lines lit, and you guys hung up. We are talking about hair loss. It's a unique opportunity to speak to Dr. Ken Anderson and to talk to us about anything, any questions you have about hair loss. Dude, I had so much caffeine today, by the way. So if I start to really ramble more than usual, let me know.
Segue.
Yeah.
By the way, I had so much caffeine today.
888-659-3727. Your mic is super low, by the way.
Is it?
Yeah. Let's take a phone call, guys.
Let's do it, baby.
Hey, you're on the air. Who's this and where are you calling from?
Hello.
Hello.
How are you guys? It's May from Kazakhstan.
What's happening, May from Kazakhstan? How are you, man?
I'm good. Good.
All right, so what can we do for you?
About speaking of that Finasteride.
Okay.
Those doctors from Headingen Clinic, they suggested me to take this. They say take one pill and split it into 4 parts. It's a 5 milligram pill, and one piece means 1.25 milligrams. Take it every day, 4 days
okay.
in a row, and 1 day off. So every 4 days and 1 day off.
Okay.
And
how are you doing?
I did it. Well, I think it is that concentration is way too much for me. I had that. Well, I think I had that side effect. When you have some irritation between the nipple and armpit.
So when you say irritation, did you feel that you were getting were your nipples sensitive? Were you getting, like puffy in that area?
No. I want to, when I take a shower in the morning, I want to, itch it or scratch it, but not the nipple.
Just the chest.
The area between, a little bit upper, between armpit. Do you know what armpit means?
I do know what armpit means, yeah.
Yes.
I'm using Google Translator,
Dude, you're doing pretty well, man.
Yeah, wow.
In terms of armpit, I'm using because I didn't use this word. And I want to, itch it and scratch it. And some irritation. And I think it was because of that Finasteride, because I didn't take anything else, and I didn't eat anything new to me.
And how did you change the dosage, or are you still on the same dose?
Now, of course, I'm trying to experimenting. So I decreased the dosage. Now I take just 0.5 milligram in 3 days.
All right. And how are you doing?
Well, I think I don't have that side effect. I don't want to scratch it, and I don't feel this irritation. And
it's interesting what Doc. It's interesting what drugs do to different people, and it could be coincidental, but it doesn't sound like it was for this kid, because he's titrating his dosage, and now he's not having any of those effects.
Yeah, the body is an amazingly complex system, and people can have unusual and less common side effects for certain. I think it's interesting that the side effects have gone away. And understand, though, there are other methods to prevent hair loss. And so maybe, Finasteride is not for you, my friend. Maybe you try Rogaine or low-level laser therapy or other treatments.
Well, you've already had. Go ahead.
That was my initial plan. That I was on topical minoxidil for 10 years, the last 10 years, and I sick and tired, if I can say so. My skin, my head skin, became a bit, how to say, weaker. I didn't like the feeling, and the plan was to get surgery, and to use finasteride.
Okay.
And so I'm gonna try. So I didn't have much time to experiment. That decreased dosage.
Okay.
I was using it only for 2 weeks, for the last 2 weeks, and that dosage that prescribed me or suggested by head game doctors, I was on it for a month.
Okay, so
and you talked a little bit. One more thing, and you said something about topical finasteride.
Yes.
Is this also alcohol based, and my skin also will become weaker if I use it, like minoxidil?
Yeah, the number one side effect of the topical medications for hair loss is skin irritation right in the area you're putting it down. But I want to point out, I see patients all the time. I do hair transplant surgery full time, and so I do see patients coming in who are still on the they're doing what you're doing, and they're getting what's called, in America it's called Proscar, and it's a 5 milligram pill of finasteride. They're using a pill cutter to kind of divide that up into 4, and they're getting on average a little bit more than what has been studied to be therapeutic enough, and they're on average, like you mentioned, 1.25 milligrams per day. That was a really, and this is, I guess, for more of our American listeners and viewers, that was a great strategy to save a bunch of money on the finasteride. But the finasteride, that was a great strategy until finasteride came off of patent, which I think was in 2014. And at that time, there are a lot of generic finasterides on the market now, and there's various websites where you can find cheap prescription. The one that I tell my patients is goodrx.com, GOODRX.com, and a lot of pharmacies will sell the finasteride at a very low cost as kind of a loss leader, just to get you in the store. Like Costco does it a lot. You don't have to be a member of Costco to use their pharmacy. And so I counsel patients that if they're using the 1.25 milligram, that they're not really saving much these days, and they should switch to the 1 milligram a day. It's much easier. You don't have to fool with the pill cutter. And it's a lot more convenient, and you get the therapeutic dose and not too much of it. So what is your plan with the finasteride at this point, my friend?
Well, I'm not sure, but I'm gonna try to maybe increase the dosage. For instance, a couple months I'm gonna take 1.5 milligram within 3 or 2 days.
Okay.
And if everything is okay, I'm gonna try to increase the dosage. And may I ask, Joe, what kind of brand do you use?
You know what? I'll just leave the room. Go ahead. Here's Joe.
I use Proscar. I'm a brand whore. I've always used the original Proscar from the time that I was originally prescribed. I'm hearing myself. I'm hearing coming back.
And so Proscar, this is original brand. It is most expensive one, right?
No. Getting Propecia, name brand Propecia, is the most expensive. With Proscar, the reason why I was getting that is because that's the original finasteride intended for prostate health. But because it's the same thing, it's 5 milligrams. It is a cost savings measure compared to name brand Propecia. I don't know what it costs for you, but here in Canada, it's about roughly $100 for 30 tablets of either Propecia or Proscar, but cutting Proscar into quarters and then taking it every day or every other day, depending on how it's prescribed, is significantly less. So I've been taking it like that forever. I've had bouts where I took a break for like 2 years to take Dutasteride. Didn't care for that. I took topical Finasteride for, I don't remember how long, but maybe a year. No, not even quite a year. Didn't care for that. Didn't think it was effective because it was just too thick to get into to get sufficiently down to my scalp, as opposed to being a fantastic hairstyling agent.
People are hanging up, Joe.
Hey.
We just had a board of calls, and now we got one caller on.
Yeah, well, so that's my experience with Finasteride, and almost exclusively name brand.
Mm-hmm.
Don't you want to know my experience with Finasteride?
Yeah.
Yeah, I wanted to ask you, yeah.
30 years on the drug. Take 5 milligrams about every 5th day now, sometimes every 4th day. 1 5 milligram dose of Proscar, brand name. Yes, I paint my bald spot and I have a little bit of a comb over, but you know what? I'm almost 60.
Really?
Almost 60.
I'm going to be 58.
Oh, really?
I don't, bro. You don't age. Come,
I
I'm
don't.
here in studio with Spencer. And
you know why I don't age? Because Finasteride, I believe, is like the first real anti-aging drug. It stops your hair from aging. It reverses the aging process of your hair. Now, no one agrees with me. I told that to Dave Asprey, and he looked at me like I was out of my mind. But I got to tell you, I mean, he decided to have a hair transplant, and he won't take Finasteride. So, you know.
Mm-hmm. So you use I didn't understand. You use Proscar 5 milligrams every.
I do it about I take 5 milligrams about twice every 10 days. So
one pill?
One pill, 5 milligram dosage. I do what's called intermittent therapy. I've been on the drug for so long. The theory is that my body was loaded up on the drug for so long. It's kind of like taking steroids, that your DHT levels really don't go back to baseline for about 2 weeks after the drug is out of your body. So just by kind of like hitting it every 4 or 5 days with that full dosage has seemed to work for me very well. Now, initially I started back in the day before anyone knew that this was going to be approved for hair loss. I started with a 5 milligram dose daily of Proscar.
Wow.
And I had no adverse effects. Actually, at one point went up to 7.5 milligrams. This is before anyone was writing about it. This is actually before my book was published. And but then as the potential adverse side effects started to roll in, I'm like, you know what, let me see how much I really need to have these benefits. And I essentially titrated down to what I take today.
So from what age you started to take one pill?
Like 27, I think.
So you was very, how to say, experimenting guy.
You're talking, you guys who do this gray market stuff, you guys are amateurs, man.
Well, I'm not. So I'm gonna try to use Proscar. I'm gonna try to use, but you know.
Well, you don't have to use Proscar if you're doing well on your current regimen, your current dosage of Finasteride. Then why screw with it? Once you change your medication, man, if you go from generic to brand name or vice versa, or if you play with your dosage, you know, you can end up going through an effluvium that you do not want to deal with. So if you're holding and you're doing okay with your transplant and with the medication you're on, I'm not a doctor, but if it's not broke, don't fix it.
Yeah.
Well, I'm not able to assess. I'm not able to assess is it broken or not because so it is also so I need time, and plus I just on the 3rd month after my hair transplant, I didn't even went to 3 months. It is 2.5 months.
So you know what? Right now, you've already titrated a little bit to avoid side effects. If you're not having any side effects, stay with what you're doing right now and see how you do, how everything's working out in 6 months. But don't just switch to brand name or to ProScar, because that's what I take. You have to understand, when I started this, man, I mean, Brooklyn was a prairie. I mean, no one knew anything about this stuff. He wouldn't understand that reference. I mean, to find a doctor.
Brooklyn was a prayer.
Yeah, to find a doctor willing to prescribe ProScar back in like 1994 was unheard of. I mean, especially for a young man.
And for people who are listening, and to our viewers who are considering getting on finasteride, the medication is metabolized by the body fairly rapidly. The half-life of elimination is about 4 to 7 hours, which really means that the drug is flushed out of your body after about 24 hours. So I would, as a physician, recommend that patients who are starting out, Spencer's titrated his dose over 3 decades.
Right.
I would definitely start, taking 1 milligram per day, or using the topical once every 24 hours to achieve more of a steady state of the medication in the body. It's interesting that you've had really good luck with the once every 5 days. I think that's a testament to that your hair loss is not that aggressive as it might be, which is obviously good news for you.
That is good news for me, Doc. But I don't even know. Here's the thing. I started really early for some reason.
Yeah.
And maybe I would not have progressed as far as other people who started early. But I am a believer of the loading kind of scenario, based on my own experience and based on, other drugs that people use for like bodybuilding stuff, where they have short half-lives and they kind of load up.
Yep.
But you're right. I mean, I started with a high dosage every day, and I did it for years.
Do you measure your DHT?
I haven't measured it in 15 years.
Oh, wow.
No, I don't want to know.
All right.
I don't want to know anything.
Proof is in the pudding?
I'm doing great. As far as my testosterone levels, people are always like, what are your T levels? I don't care. I'm strong. I'm still, amorous. I don't have like man boobs or anything yet at my age. I feel pretty good. I have a lot of energy. I don't want someone to give me a number and say, oh, you know what? You may need a little help here, when I don't really feel like the need for it. And what do you think about that? Do you think?
And he can only say no man boobs because he keeps sending me pictures asking if he's got man boobs. It's like, no.
What?
Dude, that was between you and me.
Man.
Guys, we're on air. We're on air, man.
That's actually not what I'm asking.
Well, I think it comes full circle to our talk about clean living and exercise. I feel the same way. I feel energetic, and but it does. I feel a lot better now for the last year or 18 months since I've been working out a lot. I went through a couple of years there where I just kind of fell off the wagon and wasn't working out too much, and I noticed a huge improvement when getting a good workout in 5 or 6 days a week. So
I don't find any point in doing anything unless I've done my training. Like if you want to bother me with work stuff before I work out, I won't even respond. I need to get that in order for me to function really well, and for me to help myself and my family and the people I love, and to help everyone who's in need of advice through our resources. Otherwise, I'm no good to anybody. I got to put my mask on first, so to speak, before I can help anybody else.
Yeah, I saw a patient a couple of months ago.
You lucky people. Did you forget about me?
We did. We totally forgot about you.
Who?
You lucky people because as far as I understand, you didn't work for a corporation. You have to say entrepreneurs, and you can't.
That's correct.
Schedule your day, and that would be my dream also. I would.
Here's the thing, man. It's not luck. If that's what you want to do in your life, you make it happen.
you guys extraordinary because it is so, how to say, niche you found, and the majority of people don't live like you. I work with you, and maybe I use this word incorrectly, but like hippies, or no, maybe
we're hippies.
Not situation. Not hippies. How to say.
We're free. We're free. That's
proper word.
Now listen, I mean, Dr. Anderson went to medical school.
Yeah, it was a lot of freedom. I mean, you can study or work at whatever 20-hour schedule a day you want. You pick. It's easy. All the freedom of your schedule. And even now, man, my days are long. My brother's an attorney, and he's like, he's preparing for a case. He's got 12-hour days, and I'm like, yeah, that's what I've been doing for for years now. It's some days are 10 hours, some days are 14 hours, but there's a lot of mainly 11 and 12-hour days. Hair transplants take a long time, and
it's a lot of work.
It is a lot of work.
But you know what kind of discipline
but I love
you need?
I love it though. I really do.
You know what kind of discipline you need to get up in the morning when you don't have to be anywhere and still grind and get everything done to be successful in life? That is difficult. When you're not following a path or a plan, or you're not going to school to make it happen, or you're not studying to be something specific in life and then working for, a company initially and then maybe getting into your own practice, or like your brother's a lawyer.
Yeah.
It's tough, man. It really is. When people say it to me, and I appreciate you saying this, caller, but that I'm lucky, I got to squash that, man. There's no luck involved. Yeah. It was like, okay, I think I can make this happen. I'm going to try to get published. First, I got to try to write a book. I could barely string a sentence together. And then I have to get an agent, and then I have to try to get published. Then I have to get myself on the radio. And there was no path, man. No one had ever done this before. So I got to tell you, it was pretty hard. My parents were a little weirded out by the whole situation. I got to tell you that.
Well, I was talking to my friends about this the other day. Some patients or some people are like, oh, you're a facial plastic surgeon with a successful practice. You're so lucky. And I feel the same way. I'm like, I didn't win the lottery.
No, you worked hard.
There's a difference between being lucky, which I wasn't lucky, but I was fortunate to be presented the opportunities to go to school and get this education. And so I took it personally, very much took advantage of those opportunities I was fortunate to be presented with, and just an enormous mountain of hard work that continues today. But like my fiance says, if you love what you do, you're never really working, and that's true. I get up, I don't feel like I have to go to work like I used to feel when I was in residency. It's like I get to go to work. That's something
Congratulations, by the way. I had no idea that you guys were engaged.
Oh, thanks.
Yeah, congratulations. I caught that.
Wow.
Congratulations.
Yeah, we took your advice, Spencer. It was nice.
What was my advice?
Oh, last time we were here, you were like, "Yeah, she's a keeper," and I think it was in September.
I was kidding. I'm just kidding. I think you guys.
Well,
you guys make a great couple,
thanks,
honestly.
Man.
Yeah. And I'm really happy for both of you.
Thanks.
Yeah, that's great, man. So when's the wedding?
Well, we just got engaged, so I don't.
Wow!
I haven't really
Congratulations!
Thanks, man.
Congratulations! That's great. Joe, how do you feel about marriage?
One more.
Fantastic.
First, quick question.
We're going to take another call in a second. We'll give you like another second. Go ahead.
First of all, Dr. Anderson, you look ripped, and this is how a true surgeon should look like. And
he said you were ripped.
I'm not gonna. All right.
I mean,
like a rope. Thank you, caller.
I thought those guys who are working out use this term.
Yeah, they do.
Oh, yeah, they do. They do. It's a compliment for sure.
It's hard to say ripped without a shirt on. Maybe yoked or buff.
Or fit.
Fit. Yeah.
Yeah.
I appreciate it.
Maybe you remember that you said that you would provide me a discount for developing countries for surgery in your clinic. And I would say that I thought about this, but actually, so in the end, I chose.
And then you're like, you know what? I don't want the discount. I'm going to go someplace else. Is that what you're saying?
No. I went to your website and I couldn't understand a thing. Well, can you say your again website now? I'm gonna type it right now.
My website?
Yeah.
My website. I'm out of Atlanta. I'm a facial plastic surgeon. I've been doing hair transplant surgery exclusively for I'm in my 20th year of my career. My website is AtlantaHairSurgeon.com. So AtlantaHairSurgeon.com. ATLANTA hairsurgeon.com.
All right, brother. Listen, good luck. I'm glad that you're not having any adverse effects right now, and let us know how you do in the next couple of months on Finasteride.
Spencer, I just wanted to say that I didn't find any information using this website to understand what kind of services Dr. Anderson provides.
Well, you could Google the practice is called Anderson Center for Hair, and you could Google that. Maybe I'm not sure if you. Anyway,
I found something about robotic hair.
All right, brother, listen, man, we got to go. We got to take another call.
My time is up.
Your time is up.
Your time is up.
Take it easy, man. Good luck. Good hearing from you, man. Take care.
Call us next time. Bye-bye.
Oh, and now everyone just hung up. The guy couldn't hold on.
Well, no one asked me about my hard work, and it wasn't really hard work at all. I through a great career, burned bridges, had a short
got
stint
lucky,
in clinic, and had to desperately, but luckily, turn into a business out of nothing. So,
dude, I told you that was the best move you ever made. When you called me up and you were crying under your sink and huddled in a fetal position, I was like, "Listen, man." You don't want to work for the man. You don't want to work for the man for the rest of your life.
I was in the shed in the back because I got kicked out of my house.
Yeah.
Yeah. So, anyway,
like,
that was the best move I ever made.
It was a great move. I told you that right away. When you were panicking, I was like,
I know.
What?
What were you?
You got
what were you doing? What was Joe doing before?
He was working for Haston and Wong.
Oh yeah, that's right.
Yeah, I was 11-year tenure. Face of the company, basically, for 11 years.
I'm like, just drop the mic on those guys.
Do you miss that?
That was oh, God, no.
Okay.
Oh, my God. No, not. I could not be paid enough to go back. And it's not because of them in particular. It's because just that position, I got so tired of the Finasteride questions. I was so glad to get away from that.
You only like that once a week for the show. Guys, we're going to take this call before this dude hangs up. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, guys. It's Mike from New York. How you doing?
Mike, man. How are you, man?
What's up, Mike?
Hey, what's going on? Not too much. Still in the same boat. I did meet with Dr. Bernstein again, and he had taken me off of all, I was dealing with the problem of the itching of the chest and all that. So he actually took me off of all minoxidil. He said that's a side effect, could be a side effect of minoxidil. So he took me off the topical and the oral. And he put me on a steroid for prednisone for about a week.
Okay.
The itching did seem to go down a little bit, but not entirely. So at this point, he said, wait another 2 weeks now and see before you get on the minoxidil again. And so I wanted to ask you if you had ever heard of, and ask the doctor as well that's on the show, if heard of an itching from minoxidil. When I had been on minoxidil since my 20s, and as you know, I'm now in my mid-40s. Is it possible for that to start, or should I see an allergist for that? It could be something else.
So you were on the same dose. Are you talking oral minoxidil or topical?
So I was on topical since my 20s.
Yep.
And then about a year ago, he put me on oral 2.5 milligrams a day.
Yeah. Yep. And so a year ago, and when did you start having the itching, and where was the itching?
It started on my scalp about a little around that time, maybe a little earlier than that, though, actually, if I'm being honest.
Mm-hmm.
And it got worse over time to the neck, the chest, sometimes the stomach and the arms, that kind of stuff.
Yeah, I think that with the oral minoxidil, we're seeing that there can be some what are called peripheral neurological symptoms, itching. I've got a patient who reported numbness of his feet. That's also a known side effect. You can have numbness of the feet and hands from low-dose minoxidil. So I think certainly you're going to get a little bit more in the bloodstream and in your body when you take the pill orally than you do with it topically. So I think coming off that and seeing if the symptoms don't fade away would be a good idea, or lowering perhaps the dose of the minoxidil.
Right. Yeah, he didn't mention lowering it at all, but my question was, so would it be safe to start again at some point with the topical and then see, or?
Yeah, I think the topical, a lot less gets into your bloodstream with the topical as compared to taking it orally. So I think that if you didn't have the symptoms when you're using it topically, which I believe you mentioned, then I would try going back with that if that's what you'd like.
Okay. Yeah, I'll give that a try because, and then the other quick question I had, I don't have a lot of time because I have a client coming in, but my other quick question was, so now I'm on, as you guys know, I'm on Finasteride 4 days a week and Dutasteride 3 days a week. I'm still losing major ground on my hair. It's not so much, the hairline's receded, and it's mainly the density. It's a very bad diffuse thinning. So there's no actual bald patch per se, but the density is getting less and less and less.
Mike, how old are you, and what other medications are you on, if we can ask?
I'm 43,
yep.
And I'm on just Finasteride and Dutasteride, and then I take a multivitamin and L-lysine and biotin daily.
Okay, so you're not using testosterone?
No,
okay.
No.
Okay.
So my question is, I've been on this Dutasteride now a year, and I haven't seen an improvement. In fact, I've seen it get worse. Should I get off the Dutasteride and just stick with Finasteride, or I'm like afraid to change anything at this point, but I feel like with all this overkill, it's not doing anything. And, Dr. Bernstein said, it could just be that it's punching through the medicine at this point. But I mean, I feel like I did so well for so long on that medicine, and I'm tackling it with such heavy guns, Dutasteride, Finasteride, oral minoxidil, that I shouldn't be losing this much ground this quickly,
Well, let's talk about that. Hair loss, it's sometimes difficult for patients, anyone really, to understand the phenomenon. And how I explain it to my patients is by using an analogy to something we're all very familiar with, and that is dental decay. Everyone has dental decay. And hair loss shares a lot of similarities and a couple major differences. Really, they're both natural phenomenon. Hair loss is not a disease. And so when patients ask me, when are we going to come up with a cure for hair loss? I'm like, we are not. You can't cure what's not a disease. It's a natural part of the human condition and being a man on planet Earth that we don't prefer. Like we don't prefer rotten teeth. And so sometimes, I think Dr. Bernstein is right. I think that the natural progression of this natural phenomenon sometimes can override whatever, any and all interventions. Just like people who brush and floss and use mouthwash and go for cleaning, sometimes they still get cavities. It's just kind of the nature of the beast. The two main differences between hair loss and dental decay are that not everyone has hair loss, but everyone has dental decay, and the rate at which it happens. And this is the big one, because dental decay is a little bit every day. With hair loss, you can have the same amount of hair for 7, 8, 10, 12 years, and then go through a period where you'll, over about a year or two, where you're going to lose a bunch of hair, and then it tends to plateau out. And if you plot it against time, it looks, you kind of stair-step your way down. But that's so unfortunately, I think you may be dealing with just hair loss, and you can throw the kitchen sink at it with things like PRP and Dutasteride. I'm a believer in low-level laser therapy as well. I know some anyway. So those are effective things you can try to try to curb this natural phenomenon. But I feel for you, bud. Hair loss hurts, and and when I talk to my patients who are experiencing what you're going through, a lot, it's often not a thrilling discussion, but at least you got your health but yeah, hair loss is just a fact of life for some.
So, Mike, if at this point you don't want to cut your wrists, you there, Mike?
Yeah.
Come on, man.
I'm slowly working my way to the ledge of this bridge right now.
I'm sorry, Mike.
He's the first doctor to say, "Yeah, there's never going to be a cure." You can't do something that's natural.
Which is funny, guys. Which is funny because I brought up to Dr. Burns and said, there's never going to be a cure. And I said to Dr. Bernstein, and he's a great doctor. I said, I've been hearing since my 20s we're going to have cloning. And he said, oh no, we will have cloning. And I said, well, when? I said, I'm not going to live to see it. And he said, no, you will. And I said, well, when do you think we'll have cloning? And he said, I would say probably within 15 years we'll see cloning.
Well, yeah, that's funny. That's what they said 15 years ago.
Yeah.
There's kind of there's a joke in the industry that cloning, which is obviously the holy grail, but note that cloning does not cure hair loss, right? That's if you get down to the brass tacks there.
Your follicles are still aging.
Yeah, you're just cloning the permanent follicles and putting them where the hair loss has occurred. So that's not a cure for hair loss. But, when I started in full-time in hair restoration surgery in 2003, I was at the 2003 IAHRS meeting, and they were talking about cloning was 10 to 15 years away, and it's sort of perpetually 10 to 15 years off. I did a fellowship in tissue engineering, which is cloning, and in the year 2000, and we were able to clone cartilage. Cartilage is easy to clone. It's a one-cell tissue. You got a chondrocyte, and that chondrocyte makes collagen, and you get a whole bunch of chondrocytes making collagen. There's your cartilage. A hair follicle is like cloning a kidney. There's hundreds of different cell types all in there, and they're all communicating with each other in ways that we don't understand. We're just beginning to understand if you think about it. And so I think we're a long ways off. I have seen, Spencer, you had a guest on your show, Stimson.
Yeah.
I think with a cellular scaffold, we use a lot of those in my fellowship, cloning cartilage. The scaffold idea and populating the scaffold with dermal papillar cells, I think that is very promising.
Yes.
But certainly it's still in the research phase and years away from clinical application. But I do think the next big breakthrough is going to be something in along the lines of regenerative medicine, something like, something you inject, a PRP, some sort of drug or combination of PRP and a drug that's going to be more effective in preventing hair loss. And it'd be kind of like a dental cleaning situation where you go to see your hair transplant doctor 2 or 3 times a year, and it has a very high rate of prevention or efficacy in prevention.
Now that's hopeful, Doc.
Yeah.
You just gave Mike some hope back.
There you go.
I think that's coming. 5 or 10 years, I think.
Step away from the ledge. Back it up.
That's a maintenance thing, and then at the rate I'm going, 5 to 10 years, we're looking at a Norwood 7 by that time. But my question is, I agree with you. I think it is. Because even a guy with a full head of hair, for the most part, once he gets into most of the time in his 60s, 70s, 80s, full head of hair in quotes is still very thin density. You know what I mean? Because your hair follicles are aging, and that's why cloning is not really a cure.
Look, I'm noticing some changes over the years, even though, just 5 years ago, the donor, the supposed permanent zone would have been, people were just like, oh my God, your donor is incredible. And then I'm noticing a little retrograde or just a change, overall slight, diminishing of the volume in the back. And, I think to myself, if I would have gotten a transplant to fill in the bald spot instead of painting it, and if anyone wanted to use like nape hair or whatever it is that, people were telling me about years ago, I would have lost that unless it was taken out of the real sweet spot,
Yeah, I'm experiencing the same thing. I'm experiencing the donor thinning and the retrograde now, I buzzed down the sides of my head more closer because the temples looked all thinned out.
You're having pardon me. You're having thinning in the donor area, and you're 43 years old.
Yeah, Bernstein even noticed that. He looked with a microscope and he said, "Yeah, you're also having donor miniaturization." I said, "How is that possible?" And he said, "It can happen." He said, "Look at me. You know, Dr. Bernstein, as we know, he has no hair, and also his donor area is very thin. He's much older than me, obviously, but
yeah, but he's been bald since he's like 12." I met him. He was a young man when I met him.
Yeah,
and it was gone. It's like he had like it was like a Norwood 8, never coming back. But he was cool with it. He just lived that way his entire, basically since he was a very young man.
Yeah, I have a lot of admiration for Dr. Bernstein. Actually, when I started in hair transplant
he's not bald,
surgery,
he's appropriately losing hair.
Oh no, I joined Dr. Rassman and Bernstein in practice in 2003, and learned a lot from both of those legends in the field as I got my start 20 years ago. But yeah, a lot of respect. He's a prolific publisher.
Yeah.
You mentioned the concern that I'm 43 and losing hair in the donor area.
Yeah.
Do you think this could be something else going on? Because I felt like that this whole time, especially being on these pills, I felt like maybe this could be an autoimmune thing. It could be something else in addition to my androgenic alopecia.
Okay, well, that's a very good question. There are many different types of hair loss, and you can have more than one type at the same time. Thinning in the donor area, that could be diffuse unpatterned alopecia on top of androgenetic alopecia. And for those viewers new to the subject, androgenetic alopecia is just typical male pattern hair loss. And then diffuse unpatterned alopecia, or DUPA, D-U-P-A, is where you have hair loss that can affect any area of the scalp and really doesn't preserve the donor area. This could also be a form of scarring alopecia, which is definitely autoimmune in nature, and that can present with diffuse thinning.
They tested for that. They did a biopsy for
okay,
that.
I was going
to...
What about like alopecia incognita or incognito or incognita, or what is it? It's a type of diffuse alopecia areata. Did they test for that?
That's another one. Yeah, well, the biopsy would have picked that up. Where did they take the biopsy on your scalp from? They
took it from the top of my head by where the crown is.
Yeah. I was going to ask about that. So what did that show?
Just androgenic alopecia. Hair miniaturization.
I think it'd be difficult to discern that from diffuse unpatterned alopecia because there's no inflammatory cellular findings along the hair follicle shaft to
well,
note.
Let me ask you, if it is the other thing, is it a different treatment or it doesn't matter?
No, the treatment's the same.
Okay.
And with DUPA, what I found over the years is that, and you can Google these images, the hair loss tends to be just behind the ear, kind of if you can see, just sort of right behind the ear, and you can kind of see through the donor area where you really wouldn't expect to be seeing through that area when the hair is kind of short. So if you're having...
Yeah, mine seems to be the nape of the neck, the front of the temples, and going back towards the ear from the front of the temple about an inch.
Okay.
The nape of the neck.
Yeah, that's just, that's the nape of the neck moving upwards, that's retrograde alopecia,
Yep.
But if it's just at the temples, then that sounds more just like aggressive male pattern hair loss.
Yeah, let me ask you, is it possible, Dr. Anderson, do you do, I don't know what state you're located in, do you do virtual consults?
All the time. I'm in Atlanta, Georgia. We do virtual consultations all the time. I've treated patients from 49 states and 42 countries so far. And so, yeah, if you call the office, we'll send you a template of the different angles of photographs we'd like of your scalp, and you'll fill out a little questionnaire, and then I review those photos, and then we have a Zoom meeting, and we'll sit and talk about, and the consultation slots are 1 hour long. I like to leave a lot of room for discussions about the patient's hair loss because, there's a lot to talk about sometimes. So, yeah, if you want to schedule a consultation, I'll be looking forward to meeting you.
Let them know you're Mike from The Bald Truth.
Yeah. Yeah, please mention that.
All right, guys.
Yeah.
I appreciate it. It was great talking to you, Doctor.
All right, brother.
Okay,
Take care.
Mike.
Good luck.
Good luck, bud.
Bye-bye.
888-659-3727. Hey, who's this and where are you calling from?
Hey, this is Adrian from Melbourne, guys. How are we?
Adrian from Melbourne. How are you, man?
Hey, Joe. Hey, Dr. Anderson. How are you?
I'm great. How are you doing?
Good, thanks. Spencer, I've got a day off from work, so I just woke up. Life's good.
What time is it in Melbourne?
It's about 10 a.m.
You're waking up at 10 o'clock in the morning?
Yeah, and with morning wood too. It's been great.
Good for you. Didn't need to hear that, but good for you.
Speaking of morning wood, that's why I want to ring in. I'm 2 months post-op from my second surgery. That's all going fine. Bit of redness, nothing else. And I've stuck with this 0.25 milligrams of finasteride since the procedure. Prior to it, I am getting sexual side effects, low interest, low libido, etc. But I've stayed with it because of the surgery. I didn't really want things to change. But I'm also taking oral minoxidil at 5 milligrams a day, and I really feel that I benefit a lot since I went to the oral minoxidil.
How long have you been on the finasteride at that dosage?
Probably about 7 months.
And
8 months.
Did you notice because you may or may not be joking, but if you're waking up with morning wood, there's a good chance. It could definitely affect your libido, but at least it's not affecting you physically. Yeah.
No, I was joking.
Okay.
Sadly, I was joking.
Oh, you were joking.
He's joking about the wood?
He's joking about the wood. Now.
Yeah, not the.
Now we got to
sleeping,
go.
The wood, yeah.
Well, listen, Adrian. I'm gonna let Dr. Anderson take field this question.
Yeah. So what is the question?
Okay, so the question is, I guess this is the question really, Dr. Anderson. After trialing finasteride from 1 milligram a day to
a quarter,
trying it from a very low dose and titrating up. This is over the last sort of 3-4 years. Most recently, I've started on 0.25 every day.
Yeah.
And I've been on that now for probably, let's say, I think 6-7 months.
Okay.
I'm wondering, is it worth going to a topical finasteride, knowing that could possibly go systemic? The other thoughts I've got on a topical finasteride are, I know that Zion Health and Dr. Hassan are promoting or selling a topical that has some sort of prophylactic gel that prevents it from absorbing into the skin, which is sort of counterintuitive, but or reducing the amount that's
it prevents it from going too deep. It creates supposedly creates a barrier that prevents it from going systemic. It just allows it to absorb deep enough for the follicles to get a benefit, if you believe that.
Yes.
What? Wait a second.
Well,
what was that? If you believe that?
Yeah, I haven't heard of that. Well, anyway, I think if you want to, obviously, how old are you, my friend?
I'm 56.
Okay. I think libido is an important part of life. And so personally, I would probably, you're going to get a lot more systemically when you take the pills. And so yeah. I would probably counsel you to switch to a topical form if you want to stay on the finasteride at all. Understand that the finasteride isn't really affecting the results of your transplant per se. It really is just, trying to prevent the hair loss of the other hairs around which the transplanted hairs were placed. So if you're worried about the results of the transplant, the finasteride has nothing to do with that. But I read a research paper or clinical study where when you, as opposed to taking the pill orally, the topical version of finasteride and at 0.25%, which is the standard we're using here in the United States, the amount that gets into the bloodstream, into the serum, as it is called, is 95% less. And so I think you'd be exposing yourself to less of the medication by using it topically. You're not going to get 100% of the effects of the finasteride using it topically. I've heard 80% is a figure I've heard at meetings. You get about 80% of the effects of the med, but not quite 100. But it's still better than nothing. But I think you might skirt some of the side effects with a topical preparation. And then I would also be obviously using minoxidil as well. The two have a synergistic effect when used together in a topical. So those are my thoughts on that.
Yeah, and I guess to put things in perspective too, Dr. Anderson,
Yes,
I'm 56. I'm a Norwood 7. So the reason why I want to take it is to, I guess, support my remaining native hair in the donor from aged alopecia.
Sorry,
That's
let
really
me cut you off there. Sorry, Adrian, didn't you have a bunch of body hair transplanted as well?
Yeah, I've got, look, I forget the total. I think all up I've had a combined, 14,468 grafts. And 7,000, over 7,500 were beard. And I had about...
beard, but what about chest?
Yeah, I had about 900 chest.
Okay. All right, so not a huge percentage. The reason I was asking is because there's evidence that finasteride actually inhibits the growth of body hair. Diminishes the growth of body hair. So even some doctors that are big proponents of body hair, such as Sanusi Umar and even Arvind Paswal, will say, do not take finasteride if you have
look at my arms.
A body hair transplant.
I'm like a Swedish boy. You know,
you're going to turn Joe on here.
And I would say that I definitely had a little bit more hair on my arms and hands before I started finasteride, and I have like four hairs on my chest, maybe.
It's something that I understand I understand your reasoning. I totally get it, and in my opinion, I think that when you're dealing with traditional donor hair, especially getting into cases of loss that are extreme, such as yourself and myself, I do believe that finasteride can influence the overall health of a result. But when you're dealing with body hair like you are, I don't know about beard hair. I don't know if that qualifies as far as the body is concerned. If you ask your body if it's considered to be body hair or its own type of hair, I don't know how finasteride would affect that. I think that it might affect it in a similar manner, where it does affect the quality of the growth, just like it does chest hair, back hair, arm hair, what have you. So your result's fantastic as is. I'm not saying that ceasing it would cause any sort of improvements or otherwise, but it is something to be aware of, because there's a lot of anecdotal evidence out there to support the idea that body hair growth is inhibited, degraded, as Spencer said, by finasteride. So keep that in mind as you're moving forward.
Diminished.
Sure.
But
I think
Adrian, let me ask you a question before you continue. Let me ask you a question. So you noticed a change in your libido or lost libido right away? Was anything else happening in your life? Like, how's your weight, and are you exercising, or are you attributed 100% to the pill?
No, look, I'm pretty open-minded enough. I mean, the fact I'm still taking it with this issue, thinking, it may pass. No, life is good. Life's actually better than good, stress-wise. You know, and I having trialed this finasteride before, I know the usual response. When I stop, within about 12 days, it's like a rebound effect in terms of my libido.
Right.
It's like, whoa, you know, it bounces right back to almost to compensate. In fact, it's worth taking just for that one day, but still. It is the finasteride. I have to say this too. I'm pretty grateful that I'm wanting to use finasteride as a Norwood 7 rather than a Norwood, 3, because it's not like I'm trying to prevent hair on top from miniaturizing. That's all being done in that sense, and so it's really just sort of for the so-called safe zone, which is never safe, and especially as I get older, from miniaturizing. And having said that too, I really do feel that the oral minoxidil has made a difference in terms of the thickness of the hair.
That's the thing, and we're not doctors, but Dr. Anderson, I think he would agree with this. I mean, oral minoxidil really works for a lot of guys, and if you're using that and you want to try to maintain the hair that you have, it seems like if you're not having adverse sides from the oral minoxidil, then you're in a pretty good position to potentially wean off of finasteride if that's what you decide to do, or even titrate to a lower dosage and see how you do libido-wise. And again, I'm not a doctor. You got to talk to your doctor about it.
Yeah. So, and I see Dr. Bevan Boyrell, a great dermatologist down here, and so I see him regularly. Like every sort of 6 months at least, and so I'll bring that up with him. His suggestion was to go to the topical version, and I've got a script for that. But when I had that appointment, surgery was just around the corner, so I didn't want to change anything.
Sure, I understand.
And post-op now, I'm sort of reluctant to change anything in the short term, but I think I will at least titrate down from even what I'm on at 0.25 to maybe every second day.
You may be surprised that just by skipping days, even though Dr. Anderson's correct, obviously, about how fast it basically the drug goes out of your body. I've known guys who've taken it every other day, taken even a smaller dosage, and they seem to be getting results while diminishing the adverse effects. So,
yes,
you can give that a shot. Again, not medical advice, but I've just been doing this for a very long time, and I've heard just about every story and every scenario. And there's a lot of people out there that are able to benefit from the drug without having adverse side effects. I got to tell you, Joe, I don't know. We're lucky. I got to tell you that. I mean, I don't know what my libido would be if I wasn't on this medication. I wouldn't be able to work.
You'd have a limp. Your right arm would be much bigger than your left.
I'm left-handed, but yeah, I get
it. Look like a one-armed Popeye.
All right, Adrian, man. Thanks for the call. Always a pleasure hearing from you.
Hey, ditto. But, I mean, you never read any, but yeah, thank you. And have a great weekend, guys.
All right, you take care.
Thanks for calling, bud.
Bye-bye.
See you, Adrian. Take care.
Thanks, Dr. Anderson. Bye.
888-659-3727. We've got some time. Let's see who this is. We have a lot of time, actually. Hey, you're on the air. Who's this and where are you calling from? Hello?
Hi.
Hi.
Can you hear me?
Yes. I also hear the computer in the background. You're going to have to turn that down.
Okay. Is it better now?
Yes. Hey, who's this?
Much better.
Oh. Okay, this is Guillermo from Long Island.
Guillermo, you still got to turn down your computer or your phone.
Oh, that's weird. I'm using headphones. Probably if I just use my phone without the headphones.
Let's see if we can hear. Let me see if I can hear myself. I still hear myself coming back.
Yeah,
dude.
you do.
Can't you just turn down the show? All right, man. Call back.
He said, "Screw you."
Hey, you're on the air. Who's this and where are you calling from? Hey, caller.
Hey, Joe. Can you hear me?
I think Joe can hear you. Joe, can you hear him?
Yes, I can hear you. Yes, I can hear him.
Hey,
Who is this?
Yeah, hi, Spencer. This is Anand from Hairloss Cure 2020.
Anand, how are you, man?
Oh, pretty good.
My brother.
Nice to hear from you.
Nice to hear from you, man. Finally.
Guys, if you don't know what Hair Loss Cure 2020 is, it is the go-to spot for anything and everything future hair loss and what's going on in current research.
Absolutely.
He runs an incredible site, and I'm glad that
Great
you
supporter
do
of
it,
our channel, too.
dude, because I don't want to have anything to do with that stuff. It's a lot of work.
And well done. Yeah.
Yeah. So what's happening?
Hey, so I'm calling you from my car. I was in the Starbucks, so I'm not in front of my computer. Is Dr. Anderson still there?
Yes, he is.
Right here. How you doing?
Yes, he's okay. Oh, hi. Yeah, I love hearing. I love the show when you have guests.
Oh, well, we'll try to do it more often.
Yeah.
So what's up? What can we do for you, man?
Hey, so first, oral minoxidil is so far it's amazing. It's working really well. I've had it for 3 months.
Yeah.
2.5 mg per day, and my hair shed from at least 100 a day. I can barely see 10 hair shedding a day.
That's amazing.
Yeah.
Nice.
The only thing is I have a gut feeling that maybe it's just prolonging the anagen phase. It's not really regrowing new hair.
Well, I think that's what it does.
Yeah, that's how it works.
It prolongs the anagen phase, but the thing is, you want to if you keep those follicles pumping, and keep the anagen phase, longer. When the hair is replaced, it will possibly continue to have that length of time on your head as well for several cycles. So that's really the key with these drugs, especially this one.
Right. The only thing is, I heard that so many times from so many different physicians, but there are all these people who put Rogaine on their beards and they grow brand new hair. Like, it's not just extending the anagen phase on the beard hair. It's actually growing new facial hair, So I was hoping on the scalp it could do a bit more of that too, but maybe the face is just different,
Well, I don't know if you can actually grow new. I mean, the follicles aren't just going to develop out of nothing. I think the facial hair, there was probably some vellus hair that was available.
Mm-hmm. Right. So I was hoping there would be more vellus hair available on the scalp. But anyway, I can't complain too much. It's been the best.
Well, how can you complain? Once cloning is here, you're going to be the first one to get it done.
No, that'll be the first thing that the rich people will test for the poor people.
No, man. Well, actually, you want them to test it. It's like all these people on Ozempic. Let them test it out.
Yeah. Right.
So why don't you tell people your story a little bit? Like how long you've been dealing with hair loss, why you started the site. I'm really glad you called because I think what you're doing is really, you've really offered people a lot of great information over the years.
Hey, thanks, man. I started 20 years after you, though.
All right. You're making me feel old again?
Yeah, so before I get to that, Dr. Suji, I think his price that he quoted was he was going to charge $250,000 initially if his hair multiplication ever came to fruition. So that's why I was saying that the rich people will test these for the poor people first.
Yeah, that would be. I mean, listen, I guess whatever the market will bear, but that's pretty selfish, I'd have to say. You could charge 50,000 and still do very well for himself.
I think so. Yeah. Yeah, but anyway, so yeah, I've been losing my hair. I'm 43 now. I've been losing my hair at least 20 years. So I used to go to all the old forums and I don't know if Joe Tronic, Joe, do you remember Footsie Head? You and Footsie Head were maybe the first two.
And Nervous Nelly.
People right. And what's his name? Ernie Primo.
Ernie, man.
That guy was.
Oh my God, Ernie.
That was an interesting dude, man. From Alt Bald Spot. So you've been around for a long time, man, and you started your own site. It's been crushing over the last few years. I mean, it's definitely the go-to place for anything future hair loss. You're a hair loss sufferer yourself, and you have put out a lot of information for people. For basically, I mean, I know it's not your full-time living. It's kind of like a hobby, right?
Yeah, it's become like half my living, pretty much.
That's great.
What is your other career?
I do like independent contract work whenever I need.
He's a hitman.
To supplement my income. So I've done like technical writing and technical writing. I've done like search engine marketing. I worked at Bing Ads for like a year and a half for Microsoft. I live like right next to Microsoft.
Very good.
But this is but I prefer this.
That's
just, being my own boss, as a guy from Kazakhstan said,
Well, you're still a young man, and you got a killer site, and like you and I discussed, and we've said this publicly, but we are making some of the content creators out there, American Hair Loss Association trusted content creators, and obviously we want to make that happen with you as well, and we spoke about that briefly.
Right.
So, all right, brother, listen.
I appreciate that, man.
Did you have any specific questions for the doc?
Actually, one question is, I don't know if he's heard about, there was a Korean doctor who was doing, he was experimenting, I guess, with person-to-person hair transplants. And he claimed a few years ago, I think he was fairly reputable, that he was seeing success, and unlike like heart transplants or any organ transplants, person-to-person hair transplants sometimes don't even require like anti-rejection medication, or maybe it was just very minor amounts. I don't know. And he seems so legit. And I'm one day I'm hoping to figure out a way to contact them in Korea. But is there any truth to that? Any possibility in this, or?
Well, I'm trained in Western medicine. I went to an allopathic medical school, and just based on my knowledge of the human body and how the immune system works, that doesn't really seem possible. Every cell in your body has a little barcode. It's called the major histocompatibility complex, or the MHC complex, and they're unique to you. They're unique to the individual, and that's kind of what the spleen and the lymph nodes and the white blood cells are constantly scanning every single cell in your body. And if it doesn't have that MHC complex, they attack that cell. That's why, we're able to stave off infections and so forth. So when you introduce tissue or even a sliver of wood into the skin, and it doesn't have the MHC complex that your body is expecting, typically that incites an inflammatory response as the body tries to rid itself of the foreign tissue or sliver of wood, as it were. I mean, it would be clearly that would be a real boon to the field. It would be a great thing if we could transplant one to another. Although you got to wonder about the guy who's giving up his hair. He might need that.
Right.
But in any case, I get asked about that quite a bit. And I understand that. I read, I think, in the forum where there was an identical twin needed hair from, I think there was a cancer surgery of the scalp, and a hair transplant was needed. Or maybe I saw this at a meeting.
I think Glenn Charles did that.
That's correct. Yeah, that's right. And even though they were identical twins, there were still minor immunocompatibility, big word, issues between the two. And I forget, it's been a few years since I saw Dr. Charles's talk, but I think they still there was some immunosuppression that was needed, even though they were identical twins. But it's an interesting concept, but I don't know, if it were true, I think there'd be more than just one doctor in Korea talking about it.
You would see, people in poor people all over the world scalped.
That's dark.
It is dark, but it's
pretty
the
dark.
truth. They've been selling pieces of their scalp. Oh,
Yeah.
we can get one more strip out of you. You guys can eat tonight. And that's it.
Cobalt and scalp mining.
Yeah.
Yeah, it's like a plasma donation, but on another level.
Absolutely.
Jeez.
Okay.
The cartels would get involved. It'd be a mess.
Oh,
man.
Yeah. Ooh.
So, listen, brother, man. Listen. Thank you so much for the call. You sound
sure.
sound good. Please do not post that Dr. Ken Anderson is calling this Korean doctor out and calling bullshit.
Oh,
right?
no. Not at all.
I'm just kidding.
No.
He's not going to
No, I
do
won't.
it.
No.
You can post that I am, but not him.
Yeah. leave Dr. Anderson out of it.
Yeah, that was a great answer. Thanks.
All right, brother. You take care.
All right, man.
Thanks for the call.
See you guys.
Take care.
Yeah.
Be well.
Bye-bye. 888-659-3727. What is the time? What were you going to say, Jim?
4:29.
Okay,
I was just laughing. It's like, in latest news, Joe Tillman calls out Korean researcher for BS on some claims, and Dr. Ken Anderson didn't dispute it.
Right.
Rioting in South Korea.
You're right.
Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hi.
Hi.
Can you hear me?
Yes. Can you hear us?
Yes.
Yeah. Okay, this is Guillermo again from Long Island.
Guillermo from Long
Guillermo.
Island. You've got a
Hey,
phone
buddy.
that works. Welcome.
Okay. I'm calling because I'm a little worried about a potential side effect of Finasteride.
Okay.
I want to know if it can cause insomnia.
Insomnia.
That's a good question. I'm going to see if Dr. Anderson can
I'm going to
answer
Google
but-
that because that's not what I've heard of.
Yeah, but I have not heard of it. But I would say, as a layman, of course, anything's possible, especially if you're new to the medication.
I just changed brand.
Yeah.
I didn't have this problem before, and I changed like a couple of months ago. So I don't know if it is reasonable to think that it may be related to the change of brand.
You know what? I'm reading here on the Google that, yes, insomnia, you think doctors are supposed to know everything, but, I've not had patients. I've been prescribing that for 20 years, and I've not had patients complain about that. But I'm seeing here on some credible sources that, it is associated in some patients with fatigue and insomnia, along with, we all know about cognitive impairment and sort of the foggy brain that's talked about. But apparently, insomnia is discussed.
I have had patients mention the fatigue factor.
Yeah, me too.
I have not had patients mention the insomnia factor, but I have read about it, read about some people complaining about it or saying I know a guy, that kind of thing. But my question to you is, why did you switch brands? What was wrong with the first one?
I was using, I'm still using generic, but I was living in a different state. So I'm now using a different pharmacy. So I guess that it is
Can you find out?
different brand.
Can you find out that the generic you were getting in your original medication and see if you can somehow procure that in the state that you're living in now?
Yeah.
No, I have not done that, but yeah, I guess that.
Do you
I can
drink?
try that.
Do you drink coffee?
No, not at all.
I'm on like my fourth Red Bull today.
Yeah, but I don't know how you do that. I don't.
It's the working out in the cold showers, man. I sleep like a baby.
Well, we talked about Propecia and its half-life of elimination. The half-life of elimination of coffee it's about the same.
Yeah.
It's about 7 hours, and so it's about 24. So when you drink a cup of coffee in the morning, there's still caffeine in your system when you go to bed that night. And I don't know. I used to be able to drink it anyway. Coffee, if I have more than one cup, it keeps me up. But we're not here to talk about that. But
Well, it's interesting.
Fireside chats with Dr. Anderson.
People want to know about your life, though.
I like it. We
Well-
learn more about who he is.
Guillermo, I would say, again, I'm a layman, but try to find out contact your old pharmacy and just say, listen, this may seem like a weird question, but do you know the name of the generic or the manufacturer of the generic that you guys gave me all those years? Find out and see if the pharmacy that you're working with now can get that. And they might be able to.
Yeah, I don't see why.
Okay.
All right?
Yeah, that sounds good. All right.
Yeah, and it is some good advice. Enjoy it and use it.
Okay.
All right, brother. You take care. Good
And
luck.
spread the word.
Let us know how you
Thanks
do.
for the call.
Thanks for the call. Bye-bye.
Okay. Bye.
888-659-3727. You're on the air. Who's this and where are you calling from?
Hello.
Hey, you're on the air.
Yeah, you hear me? Hello?
Yeah, what's happening?
Hey, how you doing? This is James from Delaware again.
James from Delaware, what's going on, man?
Hello, James.
Good, good. Everything is wonderful. I'm glad you guys got the doc on. I've got a question for the doc, and you guys can chime in also. My question is in regards to density for a hair transplant. So I was doing a little research, and I believe that the frontal third of the head is about 70 centimeters, and some doctors would consider good density 25 to 35 centimeters per square per hair transplant of graft.
Yeah.
Some would go higher and say 50. For the good doctor and you guys, the experts, what would be the ideal sort of density per square centimeter in regards to reaching sort of a average midway point for those that do not have sufficient donor area and as well as those that may have, plentiful donor area?
Great question. That's a great question.
I'm going to let the doc handle that while I'll go take a piss. I'll be right back, guys.
Sorry. All right. So the question is about hair densities, and what you're from James from Delaware? Is that correct?
Yes.
Okay.
Dr. Anderson, yes.
So let's talk about that. In normal native hair, like in the donor area, density varies, but typically is around 90 to 110 follicles per centimeter squared. Okay. Now, in the recipient area where the follicles are being transplanted, there is definitely a limit to how close the follicles can be placed. And that limit is not based on surgeon's preference or anything other than blood flow. There's only so much blood flowing through the scalp at any given time. Hair transplant surgery, if you think about it, it's a pretty amazing phenomenon because really, typically when you move, we're going to talk about the physiology of a hair transplant real briefly. When you move tissue around on the human body, typically, and I'm a facial plastic surgeon, and so when we used to correct facial defects after, say, a skin cancer resection, we would create what's called a flap, and we would kind of move tissue into an area to repair that area to kind of make it whole again. But that tissue always remained attached to the body for the purposes of blood supply, so that tissue could live. Blood, just like we as human beings, every little bit of our tissue needs a constant supply of oxygen through a blood supply. Hair transplant surgery is different. Each individual follicle is technically removed entirely from the body, no matter which method is used. In plastic surgery, we call that a free tissue transfer. And, the grafts are placed in a little a dish of nutrient solution, and then a little site is made, and then they're placed back into the scalp. Now, what we're asking of every single follicle is it to connect with the body and to start receiving a blood supply. We're also asking the body to reciprocate, supply this new follicle with a blood supply, of its own. And that does happen. That generally takes, however, 5 to 7 days. 5 to 7 days for each follicle to receive its new blood supply. So then we got to ask, what are those follicles living on for the first 5 to 7 days if they don't have their own individual blood supply? Well, they're living sort of on the general milieu of nutrients that are kind of floating around underneath the skin and sort of absorbing those nutrients like a sponge. They're kind of just diffusing into the scalp, or rather from the scalp into the follicle. And the way I talk to my patients about it is that whenever you plant a follicle into the scalp, it's going to need an undisturbed cuff of tissue around it, around every follicle, that's going to literally feed that follicle for the first 5 to 7 days as that follicle gets on its feet and gets its own blood supply. And so since every single follicle has a little cuff, a tiny cuff of undisturbed tissue that's going to be required to have it heal in and be a successful transplant, there's a limit to how dense the follicles can be. So that's the first part. The other part is that I did see, the bottom line, there's a limit to how close we can get the follicles with any one individual transplant, and that's the reason. It's not a worldwide conspiracy to do 2 procedures. And some patients ask me, will I need a second procedure? 95% of patients don't want one, but some patients do. And that's typically for density. There's a checkerboard analogy that's used. The first transplant lays down the red checkers, then you can come back if you want and lay down the black checkers to get an increased density into any given area transplanted. You can't do them all at once for the reasons I just talked about. In my practice, only about 2 or 3% of patients want to come back for a second, and they, for density, if they want. They tend to be younger guys who want to slick their hair back and, models and so forth. And then in terms of numbers, switching to the numbers talk, you talked about 70, 50, and, different densities in the recipient area. It's important to understand one fact. It's literally impossible to get back to the original density of hair that was there before the hair loss. So suppose your density was 100 follicles per centimeter squared. It can't happen. You can do as many transplants as you like. You're not getting back to that density. What we try to do in general is get back to 50% of the original density, because that looks like a full head of hair. And this is cosmetic surgery. And so we're taking from one area of the scalp and placing in another and trying to make that look as full as possible. Half the density looks like a full head of hair. And that's so that in this case, that'd be roughly 50 follicles per centimeter squared. That's an unrealistic amount. That's like doing all the checkers. That's too many follicles. And they actually did a really interesting study in the mid 2000s. They did a number of them, I think, at the IAHRS meetings, and they would measure it out. In this we did 20, 30, and 40 follicles per centimeter squared. And really, at a certain point, you can plant 40, you can plant 50. Only about 30 or so follicles per centimeter square would grow, even if you planted 40 or 50, because of the limits. Yeah. So then what happens is you can try to plant more, but if you think about it, you're kind of wasting those follicles because they're not going to make the trip. There's not enough blood supply for them. So it's a bit of an art. I when I'm doing procedures on patients, I look at, the age certainly matters. As we get older, the vascularity of the tissue decreases. So with older folks, especially over 60, 70, you got to sort of cut back on the density because there's just not as much blood supply there. And then there's individual variances in blood supply of the scalp. I did a procedure on a gentleman who had his life is running marathons. He runs like 20 marathons, 30 marathons a year all over the world. And he's in just, amazing cardiovascular shape. And he had some, prolific scalp vasculature. So exercise, how much exercise people are getting sort of on a chronic basis can affect how much vascularity is there. So if they're younger patients who are very active and have been for a while, I can go a little higher on the density, but really, you, as surgeons, we're shooting for somewhere around 25 to 30 follicles per centimeter squared. Those would be very good numbers. In other patients who are not as well qualified, 20 to 25 are good numbers. But that's a whole lot of information. I guess that's a long answer to a short question. Thank you for listening. Does that answer your question?
That does, Dr. Anderson, very much so.
Okay.
And, thank you for appearing on the show and, giving your professional expertise. And,
Well, what's funny is a lot of doctors in Turkey right now, they're texting some nasty stuff to me about this.
Oh, really?
I'm just kidding. But they're probably thinking it. They're probably thinking it because, these guys are selling thousands of grafts to these young patients.
Oh, yeah, I saw that. Yeah.
And they're really dense packing these guys. And I just saw a guy that is, I think he's a model or wants to be a model, like an Insta model or whatever it is. And he did his hair transplant at one of these real, well-known mills in Turkey. And it looks like someone took a sewing machine to his head. It's like we are back in 1974, except the grafts are smaller.
Wow.
It's unbelievable.
Too low and too straight.
Yeah. If I show you this guy, I'll find him. It's unbelievable.
Well, one of the things that that drew me to this question is, because a lot of times you see a lot of recipients who have moth-eaten look in the donor area. And, I did a lot of research and I'm reading and I tune in faithfully to you guys, and I'm finding out that it's blood supply. So when the doctors go into the donor and they pluck, and it's too close to another follicle, that depletes blood, because the follicle that they didn't pluck, that blood supply now has to be shared with healing and providing nutrients for a follicle that is there, and
they're also transecting. They're also transecting hair that's actually in your scalp in some cases, and they're also causing just a lot of significant trauma, and they are kind of overlapping their dissection. When they're punching, I've seen it all, man, and I know that Dr. Anderson probably repairs so much bad work. And when you look at these donors, especially coming out of these newer turnkey shops here in Los Angeles, and I know in Atlanta and everywhere else now, it's not just happening in Turkey or India; it's happening everywhere around the world, and it's pretty bad, man. I'm seeing some really bad donors, just very noticeable.
I am too, but the issue, problem a lot of times that it's not correctable.
That's right.
And that's, you see online, I comment on some videos sometimes on YouTube, and, just in general, sometimes I'll make some comments on Facebook or whatever. And I see a lot of patients, are going to fly to some country and, save a few bucks. It's the good thing about, all right, so there's an old adage in the field, the good thing about the results of a hair transplant surgery is that the results are permanent. The bad thing about the results of a hair transplant surgery is that the results are permanent. And so I do see patients in my office from other clinics that, maybe are not as skilled as they might be. And, I've got a Kleenex box right there on the desk in my consultation office, because when these patients hear that, no, that's permanent, we really can't, or if the hairline is just, a lot of times it's just too low and too straight, and the corners are inappropriate and it just doesn't look natural. And when you get an unnatural hair look, people notice right away. And to remove those grafts, that often leaves behind scarring. But the most unacceptable are the over-harvested donor areas, the moth-eaten appearance after too much FUE work. That there's really nothing that can be done in that case.
But these guys are, and I don't mean to interrupt you, Doc, but these guys are so stubborn. I posted a remix of one of Dr. Pasanga's Instagram reels, and I made a comment on it. And it was a young guy who went to one of these clinics overseas, and his hair was over-harvested. He was a mess in the back.
Yeah.
The front was a mess. He had, ridging and cobblestoning, and the hairs were put in like in perpendicular to his head.
Oh.
And so I thought that was an interesting case to comment on. And I'm getting all these comments in my comment area saying, well, he picked the wrong doctor, or he had, bad donor to begin with. And, all these kids, they want to believe in something. You can't tell them the truth. You can't say, listen, a lot of you guys may not make great candidates. Younger guys probably shouldn't have so much hair moved, so you have some hair in reserve.
Yeah.
You can't tell them that. And they don't believe you like it's going to, I tell these guys, they may be happy today, even if they somehow escaped being disfigured, the first year of the transplant or right away. But in 4 or 5 years, they could be completely lost.
Well,
all their hair is moved into one ridge in their hairline, and that's it. They have nothing else to move.
Well, one of the things that an additional question, follow-up, is there anything that a doctor may promote in regards to increasing vascularity in the donor site? And like I was looking at the jaw exercise instrument where, this is like a new type of workout instrument where individuals are now working out their jaws.
Joe's been doing that for a long time.
Yeah, increase.
That's what my wife keeps telling me.
Yeah, so to increase vascularity in the face, to tighten the muscles. But is there any sort of exercise? Because a lot of the medications are, are temporary. And, you're going to need, who wants to be on regenerative medicine for,
okay,
the rest of their life?
Yep. So I got good question. I will say that, you can certainly decrease the amount of vascularity in your scalp and very much adversely affect the results of a transplant using nicotine, tobacco, whether you chew it or smoke it. That's going to. So I tell my patients, obviously it's not a good idea to use tobacco, but if you're, if you really want to stop at least 3 weeks before and at least 6 weeks after, because that really can affect healing. In terms of increasing the vascularity, aside from chronic exercise, there is something called hyperbaric oxygen, and it's a treatment that you can that can be performed on patients pre-operatively and then immediately post-operatively in the first 10 days or so after a procedure, and that's done at a hyperbaric oxygen center. And essentially, what happens is the patient, you or a patient, would enter a hyperbaric oxygen chamber. It's kind of like one of those old iron lungs. It's about that size. It's literally typically a tube, and you get in and they seal it up, and then they fill it full of 100% oxygen at higher pressures than atmospheric pressure. And you'll feel your ears pop, and they keep you in there for typically an hour or so. That can really have a positive effect on wound healing. It increases, it has the potential certainly to increase the yield of follicles and to make sure they all grow. And so in patients with vascularity issues, I'll sometimes recommend that. I actually, about 10 years ago, I started recommending that to every patient, but I just found patients weren't willing to go to the pre and the post-op appointments. But, if one day I'm going to have a hair transplant, and I personally, when I have my hair transplant, I will absolutely be getting pre-operative and post-operative hyperbaric oxygen to really maximize the wound healing capabilities of my body. This hyperbaric oxygen, or HBO, kind of like the TV show, but it's a medical therapy. HBO is used routinely in medicine. My background is ear, nose, and throat surgery, so when we had a decreased vascularity of a jaw because of radiation therapy, and we're trying to reconstruct that jaw for cancer reasons, hyperbaric oxygen therapy is common, almost mandatory, to really increase the body's ability to heal wounds. So that's a short-term solution, is to get HBO therapy. And most doctors would be, I know most serious hair transplant doctors would have connections with regards to, I know we do, for where their patients locally, or even where you're at. HBO is a therapy that's available worldwide. So those are my answers to that question. But there's not really a medication that does that for the vascularity in the short term that I'm aware of.
Thanks, Doc. That's amazing. That is absolutely terrific.
Anything else, brother?
Well done.
That's all of my questions. You guys keep doing what you're doing. I'm going to be pulling the trigger real soon. One last question just came up. Right? So, FUE, is, as you know, follicular unit extraction, right? It's one at a time.
Yeah.
FUT is follicular unit transplant. That's the strip. However, right, me being a strip candidate, one of the things that came to mind as I was sitting contemplating my next move is that with the strip, doctors, and you guys can correct me if I'm wrong, but with the strip, doctors sort of have to guesstimate because they can't necessarily count the amount of follicular units that they're going to take. They do a area and they sort of guesstimate, well, in this area per square centimeter, I'm going to get this many grafts. As opposed to FUE, the doctor is plucking that amount of grafts. So I guess what I'm saying is, in the FUE, if a candidate said, look, I want 2,000 grafts, the doctor would then guesstimate that if I take a strip of this amount or proportion versus FUE, they pluck 2,000 is 2,000. They know what they get. In my mind, for that particular reason, would that make, and with all things being equal, not considering transaction, not considering anything else, but just the amount of grafts that need to be gathered, would that, well, in my mind, it kind of makes FUE superior in that particular regard as to FUT. Would you guys be able to weigh in on it?
Yes, I certainly can. You guys mind if I answer this one?
You're the doctor.
All right. So thank you for asking about FUT. I know there's been, obviously, especially the last 10 years or so, since about 2009, I guess 14 years, since the NeoGraft device was introduced in 2009, and since then, the popularity of FUE, which is technically follicular unit excision, the name changed a few years ago, has exploded. There are many, many, many clinics out there that simply offer FUE and do not offer FUT. There are many people who believe that FUT is actually the gold standard, and by which all other methods, including FUE, should be compared. The transection rate is low. The survival of the follicles is high. I
agree with that.
Yeah, and so really, FUT is appropriate for some patients where FUE is appropriate for others. And for those who are watching, I think in this day and age, it's a really easy, immediate litmus test to evaluate a clinic. If the clinic is offering only FUE and does not offer FUT, that's a red flag to me. FUT requires surgical skill. You have to actually be a skilled surgeon to carefully remove that strip without creating a lot of transection, and then get it back together, typically using a trichophytic closure that causes the hairs to grow through the scar, definitely minimizing the scar's appearance. And so if you're looking around at clinics, just call them and ask about FUT. And if they say, oh, no, and they talk about, some of my competitors in Atlanta talk about, oh, that's a barbaric procedure. Oh, that's terrible. That's old-fashioned. No, those are lies. It's actually a very elegant procedure, and when performed correctly by an experienced surgeon, it does the job on a good number of patients. And I do FUTs. I've been doing it for 20 years, and still.
I want to interrupt you with a thought. What's interesting to me is that the guys that would say that FUE was actually the original procedure.
Yeah,
this is the procedure that was done in the late 1930s by a couple of doctors in Japan and early 40s, and then of course the procedure that Orentrike decided to pick up using larger punches, and so. To say that it's somehow FUE is somehow a new state-of-the-art procedure, it's just It's just marketing, man.
Yeah, we're full circle back to the beginning.
Absolutely.
So anyway, back to your. So that's my view. There's a lot of bad press about FUT. It's mainly by clinics and doctors who literally cannot perform FUT because they don't know how, because they're not surgeons. Remember, in this country, you don't have to have any surgery training whatsoever to offer a hair transplant surgery to your patients. A psychiatrist today could tomorrow offer hair transplant surgery without any training or any oversight. It's the wild west of medicine in certain ways.
I will add to that. I think it's important to realize that there's only one reason why FUE exists, and that is because of the strip scar.
Yeah.
It has nothing to do with the quality of the final outcome. It has nothing to do with naturalness. It has nothing to do with density. It has nothing to do.
It has nothing to do with a good hair
any
transplant.
That's correct.
That you've heard, except for the fact that it doesn't leave a linear scar.
Yeah.
Full stop.
And there was a guy in Australia who would put up images after, and then Neograph kind of took the lead after that, of these horrific donor scars that were real, that were happening to people performed by inexperienced surgeons who were just jumping into and putting up a shingle and saying they're experts.
Bingo.
And it really it resonated with people. And honestly, when I saw that first Neograph ad, I think I was on American Airlines, or it was one of those airline magazines, and all I saw was this linear scar, which looked like it was photoshopped, and then the back of the guy's head without any scars. I'm like, that is so elegant and brilliant, that marketing.
Yeah. Anyone
would go for that.
Yeah. That's true. And Joe hit it on the nail on the head. When I counsel my patients, I say that the FUE has a singular advantage, one, and that it does not leave, in my clinic, a fine line linear scar. I want to talk about the linear scar really briefly, and why you do see some, really bad scars, and what is the difference? Well, how does that happen? It should be noted that on every human scalp, in the donor area where that linear scar ends up, the hair the scar is going across the grain of the hair at a perpendicular 90-degree angle. And so in order to see that scar, you'd have to comb up through the hair to even see it. So it's not like something that's going to be seen if it gets windy or if you get wet. In terms of what makes a good scar versus some of those egregiously bad ones, it's important to understand the scalp is some of the very thickest skin on your whole body. It's as thick or thicker than the bottom of your heel. It's very thick skin. The dermis the dermis can be 4 to 8 millimeters thick. It's kind of like a biological helmet. Obviously the brain is really important to protect. It's your head. And so the man upstairs, or evolution, or whatever you believe, they've designed it such that it's a big, thick scalp. You go to the museums, right? You see the skulls, and you're like, well, that's small. That must be the way they used to be. No, that's a human skull. Your skull is smaller than you think. When you rub your own scalp, it seems hard because it's all really packed in there quite elegantly in terms of the tissue and how it's all put together. In any case, the scalp is very thick. When you have thick skin and thick scalp, you can get very thick scars. So if you're not careful and you're not experienced and you try to take too much tissue, for instance, and don't close it correctly, or don't respect the blood supply of the scalp, there are a number of different ways that an FUT can go wrong. And you can end up with these egregiously large, unsightly, terrible scars. And so, yes, they do exist. But it's kind of a byproduct of it, at least in the United States. And I know I'm following the chat here. Yeah, you do not, a hair transplant surgeon, I'm going to use air quotes there, does not need to have any surgery training or a board certificate in anything in this country. One needs only a medical license, and that requires about 2 years, typically 1, sometimes 2 years of training after medical school. Then you get your medical license. Most people like myself stay in residency. You know, I got my medical license after 1 year. That was my general surgery internship. I didn't even touch an instrument. I did 6 more years in facial plastic surgery training, and I got my board certificate in facial plastic and reconstructive surgery. Well, back to that medical license. After you get your medical license, you're qualified to go work on an underserved area like an Indian reservation, or you could become a hair transplant surgeon. And if you check carefully, there are some big names in the industry of guys who've done just that. They quit their residency and said, I'm going to be a hair transplant surgeon. And so that's why, unlike any other medical field, it's unfortunately incumbent on the patients to do a little more research than is typical for when they're going to get surgery, you know, including the basic question, is your surgeon a surgeon? Does he have any training in surgery, or is he a physical medicine and rehabilitation doctor, or an internal medicine doctor who trained himself and grabbed an instrument and now suddenly is presto a surgeon without legitimate surgical training? So it's an unusual field that way.
Well, I'm sorry, caller. I forgot your name.
James.
James. You know,
James from Delaware.
James from Delaware. James, that didn't answer your question fully, but you got an education. And I think your question had to do with
the number of follicles.
The number of follicles per. Is going to be more accurate if you're doing.
Well, I will be So how we do that is we're going to trim down the hair in the back. You know, you get a rough estimate by you trim down a little spot, then you do what's called a densitometer. And I'm talking about how we estimate for FUT. How do you, if we're going for 2,000 grafts, how do you do that? So the hair tends to be the most dense on the back of the head, and then on the sides, less dense. And so we make 2 measurements. I'll make a measurement on the direct back of the head, and then and then a measurement on the side. How many follicles per centimeter squared are in these areas? And then I will use my fingers and literally rub up and down on the follicles in the area that's going to be resected, and get an estimate of how much laxity is there. How loose is the scalp? And you'd be surprised. Some patients have very loose scalps, some have very tight scalps, and everybody in between. And so from that, I come up with, okay, I don't want to take too little and I don't want to take too much. There's really an art form to that portion of it. And so I'll rub on these areas and get a sense for how much is the scalp going to give me. And so that might be 10 millimeters, 12, 15 millimeters. It varies patient to patient. And so let's suppose it's 10 millimeters. So that's typically a tighter scalp is only going to offer up 10 millimeters. Well, if I know the strip is going to be 10 millimeters high, and say there's 100 follicles per centimeter squared, that's going to give me 100 follicles per length of the strip. It's fairly basic arithmetic at that point, but you calculate an estimate of how long that strip needs to be based on the existing density and the width of the resection of that strip that you're going to take. And so an estimate, it always is an estimate. You cannot really get down to the accurate number before you do it, but typically you get a little extra, maybe 100 ish. 100 extra. I always try to deliver, you gotta, in this life, under promise and over deliver. So my patients know typically they'll get a little more, sometimes a couple of 100 extra. Okay, well, we just, usually there's room to put those follicles. 200 follicles or 100 in the recipient area is not a ton. And so, that's how it's done. Typically a little bit extra is removed. It doesn't make it any better or less than FUE. However, it's not nearly as relevant as the items we've discussed at this time.
But your question is also you're concerned about is it going to be more accurate if you have an FUE procedure because they're not guesstimating. That's what you're alluding to, right?
Yeah.
Okay.
Yeah, and my thing
but that's not necessarily true. Sometimes they'll put 2,000 holes in your head, and they say that they're providing you with 3,000 grafts, and they'll split those grafts, or they'll put 4,000 holes in your head and only be able to actually get 2,000 viable grafts because they go in. Sometimes these people have such a low skill set that they're actually pushing grafts back into your scalp. They're transecting right there on the spot. They're throwing tissue away. I've heard it all.
Okay.
So
I think it's important to understand, James, that when you get an estimate from
sorry,
any
Joe,
doctor
I didn't even put the camera on myself yet when I was speaking like an idiot. Hold on for a second. Can you believe this?
That's okay.
Go ahead.
I think it's important to understand that even if you go to, insert name here, FUE hair transplant specialist, an estimate is an estimate is an estimate. So if he tells you 2,000 grafts, or you come in and you say, I want 2,000 grafts because 17 other doctors told you that's what you need and that's what you think you need or whatever, they may disagree. Or even if they tell you, yeah, you need X number of grafts, once all the grafts are placed, and even before the grafts are placed, the surgeon will be constantly evaluating how this is shaping up to match his or her vision of what it is that you asked for. And more often than not, that 2,000 grafts being the number that was estimated will wind up being 2,136.
Yes,
or
Joe's right.
2,200.
Yeah.
Or because maybe they come in, it's like, what, this is a fantastic approach. I'm really glad how this is looking, but you know what, I think you need an extra millimeter. Let's get another 150. Try to work those in, things like that. It's never. In fact, if you ever get estimated a specific number and you walk out with a specific number, something isn't right, because it means that they didn't review it maybe the way that they should have, or any number of reasons why that wouldn't be a good thing.
Or unless I would say unless the whole office is amazed. That has happened to me twice in 20 years of operating. Twice I've gone for, like, say, 1,600 follicles with an FUT, and exactly 1,600 came out, and so the whole clinic was walking around like, "Can you believe that?" So if it in certain clinics that's going to be rare, though.
I want you guys to listen to this.
The exception, not the rule.
To this undercover tech who helped us out and did a little bit of a. I mean, I wanted her to do more work with us. But we did a series a couple of years ago, and I put this on Instagram, and I think this really speaks volumes of the reality of what's happening out there. Let me see if I can make this happen. Hold on.
And I know that's what patients think they're paying for. They're paying
1 second, guys.
And then we get into I am working in offices who are telling patients, and I know that they're telling patients a specific graft count, that we're going to do, 3,000 grafts today. That's what we're doing. And I know that's what patients think they're paying for. They're paying for 3,000 grafts. And then we get into surgery and we can't get 3,000 grafts, and then we're told not to discuss it and that it will be handled. But I know patients have no idea that they're not getting 3,000 grafts, that they're getting 2,400 because that's all that could be safely harvested that day.
Now, that is the reality of what goes on in these clinics.
Yep.
And, you're not going to hear that very often. And I think, the way that Dr. Anderson runs his clinic and described, the different scenarios that he deals with, it's admirable, because back in the day, Doc, you may or may not have heard of this, but, the larger chain clinics, like, I'm not going to name the names, but if they got some extra grafts out, they'd be like, look, we got some extra tissue here. Do you want it? This is what it's going to cost you.
Right.
And if they didn't pay for it on the spot, they throw it out.
I did hear that. There was some major chain. Yeah, we're not going to anyway.
Yeah.
But yeah, the worst thing about that is that the patients were under sedation.
Sure.
So you got the sedated patient, and they're like, "Hey, we got 300 extra grafts. We could, I'll charge you half price for them, or we're just going to throw them out. What do you want?" So now you got a sedated patient who's not qualified to make these decisions, digging their credit card out of their pocket in the middle of a surgery.
Yeah.
Like, gosh, that.
And that was a lot. That was really common in the early '90s, the late '90s, actually even the late '80s. I mean, I heard about it.
So unethical. And I will say about that technician clip we just heard. That's true. There's one clinic in town in Atlanta. I'm not going to name it, but every single time when a patient has been to that clinic for an estimate before they come see us, it's always the same, 3,000 follicles. And this patient might only need 1,200. Or it might be a small African-American woman. Now, African-Americans have much lower density, and if you have a little wee tiny head, you're not going to get, you might not even get 1,800 on a full FUT. But all of them are promised 3,000 follicles, because really this whole industry, this price per graft, it was born out. That's a Dr. Bosley invention when he started his clinic in the mid 1970s. The grafts at the time were the 4 millimeter plugs, right? And so you could count those grafts across the room. I mean, they're big. And so, it wasn't hard to count the follicles.
And they were also like $25 a graft back
right,
then.
Right. As I understand, anyway, I won't get into that. But, now because the grafts are so small, and I actually explain this to patients in my clinic. I'll show a picture of a guy who'd had one of those old-time 1970s follicles. I'm like, can you count these follicles? And patients are like, well, yeah, obviously. There's, 1, 2, 3, and so forth. And then I'll pull up a picture of a patient, an immediate post-op picture, the type of picture I take of every patient as soon as we're done the surgery. And that patient maybe has had 2,200 follicles. And I'll say, well, okay, now, how many follicles has this patient had? And I'm just kind of proving to them, and it's impossible to tell if that's 2,200, 2,000, 2,500. You don't know. It's just a whole ton of them because they're almost microscopic. And so then you got to ask, why is an industry, charging by the graft when they know that patients cannot figure out how many grafts they have received? And I think it's unethical. And I don't know if other clinics do it, but at my clinic, I charge by the size of the procedure. So it's sort of a range of follicles. So, so we fall in the general area. So we're not having to, promise 3,000. It just gets away from this. I feel it's a lot more ethical.
When I finally retire, I'm going to be like an advocate in another sense. I'm going to actually let patients who have the money hire me to sit there with a clicker, and I'll go to surgery with them. And I will count every graft. I will oversee everything. I will be their advocate for that day.
That's not bad. That could be a new cottage industry.
Absolutely.
Yeah.
I already took a domain as we speak.
What's it called?
Well, do they have tools that, I watched one doctor that was out in Turkey, and he invented a device
the robo pen.
Yeah, you know what I'm talking about. And he actually can click, and it shows how many.
It's actually a pretty elegant device. I don't know if anyone. I don't know anyone who's tried it personally. But it seems pretty elegant to me. I don't know, Doc. Have you seen it?
I haven't seen that. I've seen a version of that a few years ago. I know there's a foot pedal counter. Personally, I think hair restoration surgery to me is an art form. I used to be a medical illustrator, and it feels like I'm creating art when I'm.
Well, you are an artist.
Yeah, you really are. Yeah. It feels like I'm creating art when I'm, especially in the recipient sites.
But on a personal level, you're actually an artist.
I am a professional artist. Yes. Yeah. So that's one of the reasons I fell in love with hair restoration surgery, because those recipient sites, it feels like I'm creating because I am creating a work of art. It's a stipple art drawing. Stipple art is creating art with dots, just little dots. And so it really gets my creative juices flowing, and it's a very much a right-brained exercise. And so I've tried many, many times. I cannot keep count. So I have a surgery assistant as part of my full-time staff, and she has a little electronic clicker, and she, I'll ask her for gauze and so forth and anything, but she presses the button once for every little incision that I make. So I do it, I guess, the old-fashioned way, but I'm kind of old school in a number of ways like that. But
all right, man. I hope we were able to answer your question.
Are there devices, like I know they got the artist, robot, and those types of things? Is there like a pen or a type of device used that can be standard across the board? Because I do understand that, it's the.
Are you going to open up a clinic, man?
Well, no, when I want to get, I want to get one, and when I get my hair transplant, I want to make sure that I'm going through the nines and know everything. So,
dude, I'm telling you, if you have someone who loves you, or a close friend, talk to the doctor, have them sit in on the surgery, if they're willing to do it, and then you'll know. They have to be vigilant, though. You got to get them some caffeine. You got to, buy them a nice meal.
Well, yeah, research their background. Are they trained surgeons? Do they offer FUT and FUE? Look at their patient reviews. Do they have a long, multi-year track record of success? Another interesting way to tell a really good hair transplant clinic from maybe a pretender, do they have a full-time staff of technicians? Or are they using independent contractors who come, who knows who they are, just show up. There's a whole cottage industry out there of independent contractors who will show up at your office for several $100s a day, will, split the grafts and insert the grafts for the surgeon. I think quality control there would be a major issue. And so major clinics, major centers are going to have a highly skilled, experienced, full-time staff of technicians. But these are just, a few of, and IAHRS membership as well. Spencer's done, and Joe have done great things for this industry. And
thank you for that.
Oh, you're welcome, bud.
Thank you.
You're both welcome. I think you guys are doing this industry a lot of good. One show at a time, and I think a lot of patients appreciate that. And I think you've saved a lot of heartache and hardship for a lot of patients throughout the years.
Well, sadly, only about maybe 10% of your field feels the way that you do.
Yeah, it's a weird field.
When I go and get my hair transplant, I want a Basquiat. You know what I mean?
You want a what?
And a Basquiat. The artist.
Oh, a Basquiat.
Yeah.
What?
Yeah.
I don't know. Have you heard of this artist?
I don't know what that means.
It's a type of painting.
Dude, I'm totally lost.
I may be
mispronouncing it?
Pronouncing it incorrect, but it's a really expensive painting. It's like a Van Gogh.
Okay, so you want a high-end work of art. Yeah.
I hope you're not trying to say
there you
Picasso,
go.
because you don't want that.
No.
Okay.
No. He cut his hair off, didn't he?
No, that was Van Gogh.
That was Van Gogh.
Yeah.
Oh,
All right,
okay,
brother,
yeah.
listen.
Well, I don't want one else.
Listen, brother, we're going to go. It's 20 minutes after the hour. I hope we were able to answer your questions.
You guys, as usual, great. Thank you. I'm leaving with a lexicon of knowledge and another tool in my tool belt. So
All right,
thank
man.
you.
Well, good luck.
Right
We'll
on.
talk to you
Nice
again.
talking with you, bud. Good
Take
questions.
care.
Thanks, James.
All right. Bye-bye. Bye-bye.
All right, it is 20 minutes after the hour. I know we started a few minutes late, but, I don't think we have time for another call. Do we, Joe?
Let's make it quick. 5 minutes.
All right. Doc, you got 5 minutes?
Of course.
All right. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
It's Morty from Brooklyn.
Morty, last
I was going to say, where is Morty? What's up, Morty?
What's going on?
How are you guys doing this evening? I am doing fantastically well. I enjoyed that last caller. Dr. Ken, it's good to chat with you again.
Nice to speak with you, Morty.
Yes, indeed. So I'm not going to take up too much of your time except to say that my cancer is, I wouldn't say I'm cancer-free, but the doc says I'm okay, and he just needs to check up on me in 4 months, so I'm very happy about that.
But you never had cancer.
No.
So what do you mean
No,
you're
I
cancer-free?
It means that I'm cancer-free. It means that I don't have it. Never had it, and hopefully I never will.
Dude, listen, I'm Jewish. That was such a Jewish way of expressing the fact that you were cleared. You never had cancer.
Yeah, that's true. I didn't.
Yeah. Jesus.
Well, you don't understand.
This guy.
I'm looking everywhere. Look, I got a call from a friend of mine who, she's got ovarian cancer and she's got to have she's got to have everything removed except the box that it came in.
That was just such a hypochondriacal way of expressing it, man.
That's pretty funny, though.
Yeah.
Yeah, you call me Felix Unger, I guess.
Yeah.
Not
Well, I'm
related to the
glad
other
you are now
Ungers.
cancer-free, Morty.
Yes, I am, and I'm very happy about that. So that's on that front. On the hair front, things are going in nicely. I'm still dealing with a little bit of folliculitis, but it's bearable. And the weather's starting to get warmer here in New York, so that's a good thing.
Well, thanks for the update.
Yeah, man.
Thanks for the weather report.
Indeed. But since I do have you on the phone, Ken, maybe you could talk a little bit about what you've experienced with the Alma TED.
Ken?
Have you TED, the Alma TED?
No. You referred to Dr. Anderson as Ken.
Oh, I apologize. I guess I did. I didn't mean to take liberties with you, Dr. Anderson.
Gee whiz,
Morty,
man.
Morty, we go way back, bud. We go way back, Morty. You want to call me Ken? Go ahead, man.
All right, Dr. Anderson. So if you don't mind, maybe you could talk about your own opinion on that particular device, which seems to be getting a lot of press lately.
Which device?
The TED device. The one that's basically, what does it do? It's a transdermal sonograph.
Okay, so the TED device.
Transepidermal delivery is what it stands for.
Yeah.
All right, you guys
don't
know
make
I don't
me do math, Morty.
You guys know I don't bullshit you. So I'm on a. I will say I'm on a WhatsApp group of about 192 doctors, and there's been a lot of chatter on that. And I'm going to be very honest. That was a lot of chatter about that last week. And I'm on vacation this week here in Los Angeles, and I usually on Sunday nights I sit down and go through that WhatsApp and review all the information. So I have not gotten around to looking up that device, but there's been quite a bit of chatter on the.
Well, this is going to surprise you,
on the
Dr.
group chat
Anderson.
about it. Let's
But
hear it.
Morty is on that group himself.
Oh, really?
Yeah. Because that surprised the crap out of me too.
Yeah. So no, that's Morty. That's on my to-do list, bud.
Okay, cool. No, that's fine. I'm always curious to hear things about whatever else is out there, especially where there's chatter. And you're a very well-respected doctor, and I figured you might have an opinion. That's why I asked. I have heard things and some things which seem a little hard to believe about its effectiveness. And I don't know. It's one of those things where it's like, okay, this doesn't seem like it should work, but evidence seems to be to the contrary, and I wanted to get another person's opinion is why I asked. But yeah, I mean, that's it. I just wanted to call in to just say hi to you guys.
Here's the thing, it's now being promoted as like needle-free and pain-free, way of kind of doing PRP. And, they were at the Global Hair Loss Summit. I know Dr. Bauman did a talk, and I know Dr. Cole is doing some work with it, and I know some other people who, are claiming that it's really been of benefit to their patients. It seems very magical, but I'm certainly giving it. Say that again?
I said that would be a word that I would use.
Yeah. But I'm giving it the benefit of the doubt because, again, Alan Bauman seems to be a big believer in it. John Cole now seems to be a believer in it. There's some other doctors that are IAHRS members who are starting to work with it. I know Ron Shapiro is very interested in using it. We'll see.
Interesting.
Yeah,
no, that's definitely a wait and see. And one follow-up question, and then I'm going to drop. And it has to do with a way of measuring hair density. It's a device called Hair Check, which I've also heard Bauman talk about. Yeah. Have you used it, and do you have any opinion on it?
Yes, we have a Hair Check device at the office. So what a Hair Check device is essentially a device that measures hair volume, not so much follicular density, but hair volume. You basically mark out a square centimeter of hair on the scalp that you're looking to check, and then you comb just those hairs. It's kind of a tedious process, but you comb just those hairs out from that square centimeter, and then you kind of fit it into the Hair Check device. And the Hair Check examines the exact volume of all those hair follicles within that square centimeter. And I think that it's best suited, at least in my practice, for tracking women's hair loss, female pattern hair loss, because it's not female pattern loss, as you know, tends not to be so black and white where the hair is, where you get a receding hairline and there's no more hair. It tends to be sort of a general diffuse thinning across the top, and when it's a good way to follow interventions such as PRP or topical minoxidil if it's actually creating some thicker hair shaft diameters that really maybe you don't see with macro photography, but you can see with these Hair Check devices, and it kind of, especially in the early stages where the changes are not so obvious, can provide a lot of hope and positive feelings, for the women who are dealing with this hair loss as they see it trend in the positive direction before you really see it in terms of the photographs and before the patient may feel it with their fingers running through their hair. So I think it's an important part of it, at least in my practice, with female pattern loss.
We had Bernie Cohn at the Global Hair Loss Summit. I interviewed him, and he's the guy who invented the hair check. And unfortunately, I think that it was a device that was not really accepted by the industry back in the day when I started in the field. And then Bernie licensed the device to like a cosmetic company. I think that's the way it worked. And then they were trying to sell it at hair salons and stuff like that. And it kind of almost went out of vogue. Doctors just weren't using it. So there's still really only a handful of doctors who are using the hair check device. And I think it has
I know
merit.
Dr. Cole does.
Go ahead.
Yeah, I know that Dr. Cole does, and I mean the thing about it, I would say it definitely, if you've got enough length, it certainly can be useful. And I've seen
that's what she said.
Wonder about,
I was just thinking that. Gonna need that length.
Good night.
But it measures girth, right? After all.
I was going to.
But yeah, I mean the concern I have with it is, and this is to your point about tracking, is that if you bring the same patient back a month later, how do you know you got that same 2 square centimeters, and how do you know that the change in measurement is due to, is due to actual increase in volume, or how much of that is part of the error that that may occur?
All right, so good question. So 2 answers. One is in terms of how do you check the location. The hair check device that we have comes with this pair of glasses frames. And then it has coming up from the middle of the glasses in between the 2 lenses is essentially a measuring tape. And so you sort of put that up on top of the scalp and then measure back a given number of centimeters from the center of the glasses. And then you note that down on the chart, and you would measure that same number of centimeters back in the midline again. So that's how we try to get roughly the same area measured. And then the second answer to the question is about... how do you want to how do you know if what is working is working? You want to let enough time elapse between measurements. So you don't want to be measuring every week. Typically I would say, every 8 weeks or 12 weeks, typically every 12 weeks would be a much better idea to really see that needle start to move with that, or really any device.
Cancer-free Morty, I hope we were able to answer your question.
Always the best, you guys.
I think it's now bald-free Morty.
Bald-free, cancer-free.
Yeah.
Thanks for calling, Morty.
Diabetes-free, right?
Yeah, well, for the moment. Anyway, guys, it's a pleasure, and it's so great to hear your voices. Dr. Ken, Joe, Spencer, love you guys.
All right, man. We love you too, brother. You take care.
Thanks for calling, buddy.
Good to hear your voice, bud.
Anytime.
All right. Okay, guys, we are ending the broadcast. I want to thank everyone who called in. Of course, I want to thank Dr. Ken Anderson for stopping by. It's always a pleasure to have him in studio.
My pleasure, man. It's wonderful to be here.
Yeah, and I want to thank, are we allowed to mention his name? The guy from Hair Loss Cure 2020?
Yes.
He did?
He mentioned it. Yes.
All right, well, I'm not going to mention him just in case... Because I know he's very finicky.
Hair Loss Cure 2020.
Yeah. So, Bob, thank you for calling in. Guys, check out Hair Loss Cure 2020. They support this broadcast, not financially, but this guy's always been promoting the show for a very long time, and we appreciate what he does, and we appreciate him. Guys, until next time, be strong, God bless, and thank you so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.